Welcome to Health and Social Care. You've clicked on this option because you're interested in taking health and social care as an option in Key Stage 4. This is a particularly difficult thing for you to do because you haven't studied any health or social care in Key Stage 3. Because of this, I'm going to try and give you as much information as I can about why this is a particularly good subject for individuals to study in Years 10 and Year 11. One thing I like about health and social care is we can use lots of relevant, up-to-date resources to make the topics real and understandable. So in the current pandemic, we have used quite a few resources on the healthcare related to the hygiene and the spread of COVID. We've looked at the quality of nurses. So we've been able to update our resources and materials we use with the students to make them as inspiring and engaging as we can. The qualification itself is not a GCSE. It's a vocational qualification, like a BTEC. We do not, however, complete a BTEC. We complete what they call a Cambridge National, which is like a BTEC. The Health and Social Care Level 1 and Level 2 award is the qualification we follow. This qualification is made up of 4 different components. One component is the external exam. The external exam is taken in the January of Year 11. It's a 1-hour external exam, and you can see from the paper that some of the questions are a couple of sentences, some of the questions may be tick boxes, other questions might require a longer response. So if you look on some of the questions here, they're a little bit longer for you to complete. A lot of health and social care is very practical. It's lots of experiences you might have had outside your learning, and these can be applied and used to develop and sustain your answers. Unit 21, core unit, that will be completed externally in an exam room. The other parts of the course, they are measured and studied internally. So this is an internal assessment. We complete 3 other units to the assessed unit on care values. Unit 22 is a unit on communication, which is absolutely brilliant. So it talks about verbal, non-verbal communication. It talks about communicating with a range of special needs groups. It talks about how to relate health messages in all sorts of contexts. Very practical, very hands-on. Unit 27 is creative activities in the early years, and we actually normally take students into a classroom and we make and create activities with young children and have lots of fun. I'm looking forward to when we're going to be able to do that again. And the final unit we look at is understanding nutrients, the nutrients needed for good health. And this again is a really practical qualification where we can discuss our own experiences and relate them to a range of health conditions and how diet can actually prevent and sometimes help people live well with medical conditions. The qualification itself opens the door to many options. So if you look at a range of career prospects, you can see that in the Southwest here, health and social care is set to improve and increase considerably. And at the moment, 15.7% of employment is in health and social care. 8.1% of local employment in the Southwest region is in education. So there are lots of opportunities if you want to use this qualification to open doors to next choices. Additionally, if you want to go into things like early years, again, it's a growth sector. This qualification is a really good foundation for going on to any sort of early years learning. Going into teaching, childcare, support assistance, a range of different options are available for you. So why take health and social care? If I had to sum it up very simply, I would say it's actually quite fun. It's practical. You have lots of chance to actually develop yourself and think about what your own skills are, but also it gives you an opportunity to go into the caring professions and anything where people are involved and the understanding of how individuals learn, how individuals can be supported with their health. So it's certainly worth a consideration of you taking this as an option.